So everyone, today we are going to see about the relation of temporomandibular joint. So this is the temporomandibular joint and this is the anterior relation and this is posterior relation, and the structures present outside the temporomandibular joint. This is the lateral relation, and the structures present inside the temporomandibular joint forms medial relation. So lateral relation, it has a skin, superficial fascia, parotid gland, and the temporal branch of the facial nerve. First, we have the skin. After removing the skin and superficial fascia, you can see the parotid gland. After the parotid gland is removed, you can see the temporal branch of the facial nerve, which is present lateral to the temporomandibular joint. So next, the medial relation is formed by two bones, tympanic plate and the spine of the sphenoid, and two nerves, auriculotemporal nerve and the cauda tympani. And one artery is middle meningeal artery. So this is the posterolateral view of the skull. We are zooming the picture, and this is the temporomandibular joint. So these structures forms the medial relation. So what are the structures? The first structure is tympanic plate, and the second bone which forms the medial relation is spine of the sphenoid. So what are the medial relation is? It has a tympanic plate and the spine of the sphenoid. So the one artery which is present medial to the temporomandibular joint is, this is external carotid artery. So this is external carotid artery. From the external carotid artery, we have the maxillary artery. From the maxillary artery, we have the middle meningeal artery. So this is middle meningeal artery. Now we are going to clear these ligaments. After clearing the ligament, you can clearly visualize this is the middle meningeal artery, which is a branch of maxillary artery, which is the only artery which is present medial to the temporomandibular joint. So this is middle meningeal artery. And this nerve is the auriculotemporal nerve. This auriculotemporal nerve, it encircles the middle meningeal artery. So it comes under the medial relation. So this is auriculotemporal nerve which encircles the middle meningeal artery, which comes under the medial relation. One more nerve is the cauda tympani nerve. Just below the auricular temporal nerve, you can see the cauda tympani nerve, which joins with the lingula and it supplies the tongue. So medial relation, we have spine of the sphenoid and tympanic plate, and one artery is middle meningeal artery, which comes out through the foramen spinosum, and this artery is encircled by the auriculotemporal nerve. Below the auriculotemporal nerve, we have the cauda tympani nerve, which forms a medial relation. Next is the anterelation. Anterelation is mainly formed by the lateral pterygoid and the masseter nerve artery. So this is the temporomandibular joint, and anterior to that we have the lateral pterygoid muscle, which forms the anterior boundary, and this is the masseteric nerve. So this masseteric nerve comes out through the mandibular arch and supplies the masseteric muscle, which forms the anterior relation. So anterior relation is formed by lateral pterygoid and the masseteric nerve and artery. The posterior relation is formed by parotid gland, superficial temporal vessels, and auriculotemporal. So parotid gland also forms the lateral boundary, and auriculotemporal nerve also forms the medial relation. So this is the parotid gland, which also forms the lateral and the posterior relation. And this is the superficial temporal artery, which is a continuation of external carotid artery, which runs posterior to the temporomandibular joint. And third structure is auriculotemporal nerve. So this is the auriculotemporal nerve which forms the medial relation, and it goes behind the neck of the mandible and it runs posterior to the temporomandibular joint and goes to the temporal region. So it also forms the posterior relation.